This morning, we're going to head out to meet a gentleman that moved from Kenya to the United States, got a nursing degree, worked as a nurse for 25 years, and he spotted a need, something that he really wanted to change and make a difference in patients' lives. So he left nursing, became an inventor and an entrepreneur. And what he's invented is a special type of bed. Sadly, patients far outnumber caregivers. And unfortunately, people that are bedridden tend to lay in their urine from 2, 4, 5, 6 hours before they're tended to. So Ezra invented the type of a bed that would drain that urine away from their body, help preventing the rash and the sores from developing, and buying them time before they're tended to. It's not a substitute for being tended to, but it definitely buys them time, and hopefully they don't get these rashes and these sores that are so painful to these patients. So let's head out there and see what Ezra's done. Hello, Ezra.
Hello, Curtis. How are you?
My name's Ezra Nyankira, and
My name is Edward Nyankira.
The name of our company is Easy Drain Care Products. This idea came about, first of all, I've been in nursing or healthcare for a long time, since January 1993. During that time, I've been a nursing assistant, I've been a medical aide, and a nurse. And during my nursing years, I realized that the population which is needing help is getting bigger, and the caregivers pool is getting smaller. And this particular product was inspired. I was a nurse, a wound care nurse for an agency. I would go to people's homes, change their wounds, and I leave, I go home. And I noticed with one of the patients I was taking care of, it was a man and a woman, a couple, and the woman was bedridden. The man was able to get around, but he was frail, couldn't really give care to the wife. And when I took care of her, I went there. She had wounds on her coccyx. I could change the wound, bandage, clean her up, and then put clean bandages on her. And then I leave, and then put a diaper on her and leave. And the next day I came, I noticed that and I noticed that the diaper I left her in with the previous day, she still was in that diaper, which told me nobody changed that lady for 24 hours. And the wound was getting worse. Even though the agency I was working for was providing all the equipment and everything needed to take care of the wound, it wasn't getting better because simply she was laying in her urine for too long a time. So her skin was getting worse. And whenever I went to take care of her, after I take care of her, she would hold my hand and cry and say, "Don't leave, because it hurts." And that really touched my heart. And I started thinking there got to be a better way to take care of people other than just putting a diaper on them and leave. That's how this idea started. I started thinking, brainstorming what other ways can be used. That's when I started in my garage. I bought some foam from Joanne Fabrics, put holes on them, and plastic on top to see if that can work. I did that for a while, and then I put it aside for quite a few years. And then I went to work for another agency. And I got, now the situation was even bigger. Now I was taking care of more people, and the issue seemed to be the same. You get there, the patient is drenched, they've been sitting in urine for a long time, and their skin is getting worse. That is when I went back and pulled up my old drawings and idea, and I seriously started thinking about it. Of course, I talked to my brother here, Edward, and a couple of my friends, and we thought it's a good idea. And then I went ahead and found an engineering firm, and they helped me design the product and wrote the patent paperwork and things like that. And then we started looking for a company to help us develop the product. We called many companies and we talked to them about the idea, but many companies couldn't do it here. And I found one company in Atlanta which told me they could do it, but the price they mentioned was just out of my reach, because they told me it will take about $250,000 to develop the product as I wanted. And that really was too high for me. And then I ran into some guys in Cincinnati, Ohio, who said they connect manufacturing companies or companies from the US to the Asian market. And I called them up and they said, we could probably find you someone in China who can do the product. And I said, okay, let's give it a try. They actually found me at the company and we contacted them. We talked to the company and they said they will produce the prototype. That was really reasonable because they were only asking about $18,000 to produce the prototype. But even though it was much, better than what I had here, it was still a lot of money for me at that time. So I called up a couple of family friends and we sat down and came up with the money and we sent it and they produced a prototype. They sent it to us. We saw the concept can really work. Yes, this is the special bed which incontinence people use or will be using. And when they have an episode, the urine goes through the mattress into the correction chamber under the bed. I'm going to demonstrate to show how it works. This is how it works. A patient will be laying in bed and they will have the episode. They'll be laying right there. And let's say they had an episode of incontinence. They will have the urine.
Okay, so it just doesn't go all over the bed.
It doesn't, because there are holes situated strategically in the mattress, and the urine drains through the mattress to that correction chamber under the bed. Well, what this does is the patient then doesn't have to lay in a wet bed or diaper for extended amount of time. With this, about 98% of the water or the urine goes to the correction chamber, and the other little percentage which remains there dries up within 20-30 minutes, so the patient doesn't get to lay in a soaking wet bed for an extended period of time. That helps with the skin integrity, good care, reduces UTIs.
What's UTIs?
Urinary tract infections.
Okay.
And then it also reduces the amount of work caregivers have to do to take care of the patient or the person who is bedridden. And now the people who are coming into nursing or as nursing assistant, that pool is dwindling. It's getting smaller, while the number of people needing care is getting bigger by the day, and that doesn't seem to be slowing anytime soon. When you look at the demographics, it's going to get worse.
Show me a little bit about the inside workings of this bed here.
Yes, I will strip the bed so you get to see the concept. We have this special cover, which has a net right
Okay.
here in the middle, which lets the urine go through, and that's special for this bed. And then here we have this. This is a soaker skirt, just in case somebody has too much urine and it runs the service. This one will catch and it doesn't
Okay.
go all over the bed. This is the soaker skirt. The next is the special part here. This is silicone, which has tubings which go through the foam mattress.
Oh, okay.
This foam mattress goes through to the bottom of there, so it looks like this. So these tubules go through and they are suspended here,
Okay.
so they don't touch this. That way you don't get to feel the pressure from the tubules.
All right, yeah.
They go into this funnel, which is you can take out for easy cleaning, and it leads to the correction chamber. Which is that. That's where we poured all that water. It went through the funnel into the chamber here, and then the caregiver can just empty this, and then the patient remains comfortable and dry.
Generally speaking, is this a stock bed and you just made a different mattress and collector and all that, or is it all different? How different is it?
Regular beds usually don't have this correction or
Right.
drainage system built into it. So we had to design a bed which has the drainage system built into it, and then the special part which will accommodate the drainage or the water from the mattress. So the frame itself looks like a regular hospital bed, but then it has that modification right here which allows us to put the funnel and the correction tank.
Okay, looks pretty cool. I like that.
Thank you.
All right, so show me this other version you have. I believe you said it's mainly for people that need a bed in their home.
Yeah, we also came up with the home edition. This is just for those people who are in their homes and they don't like a hospital-looking bed in their home. It has the same features like the one we just seen. It has the middle part, which has the silicone, and it empties the same way like the other one. It has the funnel built underneath, which collects the urine just like the other one.
Okay.
And then we have this mesh underwear. This is what people will use for those who don't like to sleep without any garment. They will use this. It will let the urine go through, and if they have bowel incontinence, this will catch the bowel so they don't block the drainage for the urine to drain, and it will let them stay dry. That one is reusable. It can be washed and reused in a home setting, but these are disposable. They will let the urine go through, and they will hold the BM back, or the bowel movement, so that it doesn't clog that. And these ones, once reused, they get disposed. These ones are good to be used in nursing homes and hospitals. That one will be used in a home setting.
Okay, so this bed here looks like it's probably significantly less expensive, obviously.
Yes, it is less expensive, and it can come in many dimensions. It can come in queen, twin, and whichever size you want it, we can provide that for the home so that it looks okay. And we can paint it in whatever colors.
Okay, so you can stain it and
Yes,
just whatever matches a person's home.
yes, whatever they want. If they want it in black, we stain it black. If they want it
All right, looks pretty cool. I like it. I like your idea. Very, very innovative. Show me your smaller version.
Okay, this is a cushion we designed for those people who sit in one place for extended amount of time without access to the bathrooms, like truck drivers, or if you are on a road trip and you have children, or somebody who's elderly and they are sitting in a chair and they can't get up to go to the bathroom. This part here is for women. When they urinate, the urine goes through these holes here, there's one-way valve, so the urine goes into this tank under here, and it doesn't come up. For the men, they use this part here, and it goes to the tank, and it doesn't come up. And then when you get to where you're going, it's easier. You can, you open it, empty it, and then it's ready for use again. It's also very easy to clean, actually. You just open the buckles on the side like that. Once they are open, there's these two valves you push there, and it opens up, and then you can wash it, and then just put it back.
So it looks like it's made out of hard plastic. You could just wash it, hose it down with a water hose or something.
Yeah, yes, it's actually you have to wash it with a water hose, and it's clean. It remains clean, and it has a cushion right here, so you're not sitting on a hard surface. And then it has this little compartment here for those who have young children and they're somewhere, or even an adult. Sometimes, if your stomach is not being very cooperative, you put a small bag here, like the one we use for pets. You use it, tie it up, and you put it in this bag here, which comes for the bag. It has a zipper on this side. You put it in here, and then you can dispose it whenever you get to where you are going. And this part, you put the clean supplies on here. And then this whole unit goes into a bag, into this bag, like that. Then you can zip it. Zip it. And it's a nice carrying case. So you can take it wherever you're going, and you know you are taken care of when nature calls and you have no place to go. I believe right now I have come to a point to say sometimes if you don't know something, it's better to find somebody who knows and ask and get some advice from somebody who understands.
What an amazing story Ezra shared with us. I think the biggest takeaway that any entrepreneur should get from this story is the fact that Ezra didn't give up. He persevered. He kept asking different companies and different people, asking companies that would build or help design and build his prototype. And he got a quote for $250,000. And most people would have thought, all right, this is too much for me. I can't do this. And they would have just left it for the rest of their lives. But Ezra persevered. He kept on asking, he kept networking, and he finally found a company that would build his prototype, help get him the drawings for his patent, all for $18,000. He would have never been able to do it had he just stopped at that $250,000 quote. So my hat off to you, Ezra. Thanks for sharing your story. I hope this video has inspired some of you. See you next time. Thanks for watching.